come on to examination of atrophic rhinitis. So examination, what all features can be seen in atrophic rhinitis. So a nasal cavity will be full of greenish or black dry crust covering the turbinates and septum. Nasal cavities appear roomy, means large area will be present with atrophy of turbinates, so much so that the posterior wall can easily be seen of nasopharynx can easily be seen. So nasal turbinates may be reduced to mere ridges. Nasal mucosa appears pale. Septal perforation and dermatitis of nasal vestibule may be present. Nose may show nasal deformity. Atrophic changes may be seen in pharyngeal mucosa. Which may appear dry and glazed. It is a feature of atrophic pharyngitis. Cough and hoarseness of voice with atrophic laryngitis. Now we come on to prognosis, that will the disease will be better after some treatment, chances of betterment of disease. So disease presents for year and tendency to recover spontaneous in middle age. Treatment can be medical or surgical. So first we will see medical treatment. Medical treatment, we will maintain nasal hygiene. Maintaining nasal hygiene by removal of crusts of associated putrefying smell. Further check crust formation. Nasal irrigation and removal of crust. So how to remove these? Warm normal saline or an alkaline solution made by dissolving a powder or teaspoon of powder containing sodium biborate 1 part and sodium chloride 2 part in 280 ml of water. Solution is run through nose. One solution is run through one nostril and comes from the another. 25% glucose. Second step will be 25% glucose in glycerine. After crusts are removed, nose is painted with 25% glucose in glycerine. This inhibits the growth of proteolytic organisms which are responsible for foul smell. Local anesthetics will also be given. Step number 3, spraying or printing the nose with appropriate antibiotics. It helps to eliminate 2% infection. Quercetin anti-angina solution. This is a drug solution which contains chloromycetin, estradiol, and vitamin D2. Estradiol therapy helps to increase vascularity of nasal mucosa and regeneration of ceruminous glands. Placental extract. It will be injected submucosally in the nose, may provide warm relief. Systemic use of streptomycin 1 gram per day for 10 days reduces crusting and odor. Effective against Klebsiella. Potassium iodide can be given by the mouth. Promotes and liquefies nasal solution. Now we come on to surgical treatment, that is Young's operation. In Young's operation, both the nostrils are closed completely, just within the nasal vestibule by raising flaps. They are opened after 9 months or later. In these cases, mucosa may revert back to normal and crusting reduced. Modified Young's operation to avoid discomfort. Modified Young's operation is done bilateral nasal destruction. It aims to partially close the nostrils, narrowing the nasal cavity. Nasal chambers are very wide in atrophic rhinitis, and air current dry up secretion, leading to crusting. So narrowing the size of nasal cavities helps to relieve the symptoms. As air currents reach the nasal mucosa, it dries up the secretion and it leads to crusting. Some techniques are submucosal injection of Teflon paste, insertion of fat, cartilage, bone or Teflon strips under the mucoperiosteum of the floor and lateral wall of nose and mucoperichondrium of the septum. Third one is suction and medial displacement of lateral wall of nose. Secondary atrophic rhinitis. So specific infection like syphilis, lupus, leprosy, and rhinoscleroma may cause destruction of the nasal structures, leading to atrophic changes. Atrophic Atrophic rhinitis can also be result from long-standing purulent sinusitis, and radiotherapy to nose or excessive surgical removal of turbinates